In this video, I'm going to be going over case number 1. So this is the first case in our example cases, and we'll kind of go through more of the basics in this one and get more advanced as we go on. So anytime you're going to start a new case, obviously open the Blue Sky Planning software, and for a new case, you're going to go to File and New Project. Don't do Open Project, because that would be if you were opening back up a case that has already been worked on. Navigate to wherever you have the files saved. If you've taken my course, then I've got a folder for you created that's called New BSB Course Files. And again, this is case1.com zip. This is a straightforward case of just a single mandibular implant. Click OK, and you will notice those are zipped files. Blue Sky Plan will open zipped files, and so I would suggest when you are exporting your DICOM images from your cone beam that you would export them in a zipped file. It will take up much less memory. When this window comes up, you're going to see the highlighted volume right here. If you had multiple scans on this patient, the second or third or whatever would show up right here. But obviously this is only one, so I can click OK. If there was another that I needed to select from, I would highlight that and click OK. Now the next window that comes up is important. Don't skip by this step. This is your volume rendering, where you can determine how much of this volume you actually want the software to show. Now it's important to know that the software will get bogged down by having too much excess data. Unless you've got a really powerful computer, it's worthwhile to limit that. So first thing you're going to want to do is always grab these rotation rings and get the volume where it's oriented. Ideally, you want the occlusal plane to be perfectly parallel to the floor. And so you can see the patient's chin is up slightly. I'm going to rotate that down. And once you've rotated it and you have the occlusal plane parallel to the floor, now you want to limit your field of view. There's no point in us having the orbit and most of the nasal bones or the cervical spine in this. We're planning a lower first molar implant, and having all of that excess data is going to do nothing but slow us down. So grab these sliders and eliminate some of this excess data that might cause you to bog down. Alright, and then click OK once you're happy with that. The software should render the volume that you told it to, and you should see that when this pulls up, we're going to have the 5 standard views in Blue Sky Plan. Now it's worth mentioning also, if your view does not look like this, this is the main view that you want to have for implant planning. If it doesn't look like that for whatever reason, come up here to View Perspectives and call this Implant Tangential 3. There are other views in Blue Sky Plan. For example, if you wanted a traditional radiology view, you could go to the MPR. There's many different ones, as you can see right here, but for implant planning, you want to be on Implant Tangential 3. Now let's go through a few of the windows here and just do some review and the mouse functionality before getting into the actual case. So bottom left window you'll see is the 3D rendering, and again you can see that it cut off all of that excess data that we told it to in the last step. To rotate this volume, you're going to left click and hold, and then you can rotate it 3-dimensionally in space. If you want to zoom in, you're going to right click and hold. If I push forward holding the right mouse button, it's going to zoom in. If I pull back, it's going to zoom out. And then if we need to bodily move this, we can hold down the right and left mouse button. That will move this bodily, and these are very important functions to know how to use, because especially when you begin stitching models or trying to look at things from different perspectives, it may be necessary to zoom right in at a particular orientation on the distal lingual cusp of this tooth. And if you don't have the ability to bodily move things and orient them to the right position, you're going to really struggle in stitching and some of the other functions in Blue Sky Plan. So take a moment, pause the tape, and master that before we move any further. If you need to maximize this window, and this is in every single window, you can maximize it by clicking this button in the top corner, and you would minimize it by the exact same way. Moving on to the window above that, this is your cross-sectional window. And remember, this is Implant Tangential 3. The 3 refers to having 3 cross-sectional views. You'll notice that this has a blue, yellow, and red marker over to the side, and those correspond, if I zoom in here, to the blue, yellow, and red lines in the cross section of your focal trough. So these are all slices 1 millimeter apart, as you can see right here, 33, 34, 35. These are 1 millimeter slices apart, and they're cross-sectional, not through the patient, but through the focal trough, okay? So if you need to scan through the cross sections of the teeth, you can just simply hover in this window and use your scroll ball. If you go the other direction, it will scroll cross sections through the other direction. You won't generally use this a lot, but same functionality as the last window. If you need to bodily move, you would hold the right and left mouse button, and you can bodily move this. If you need to zoom in, you'll hold down just the right mouse button and zoom in or out by pushing forward or back. And once again, if you need to expand the window, just hit the top button and minimize it the same way. Now the next window is very important. This is your axial slice. This is basically slices horizontally to the floor through the patient's head. And same thing, if we use the scroll ball in this window, you're going to see that the blue line here, which corresponds to this blue line, everything is color coordinated. You can see where you are axially in this volume. And so as I'm going up with the scroll ball, it's scrolling up through the patient's head, and as I'm scrolling down, it's going to go down through the volume. And so this is a useful window that you'll use quite a bit. But the other reason this is very important is because this is the window that houses our panoramic curve. Now the panoramic curve more or less sets the tone for all of the other windows in Blue Sky Plan. And so, for example, you'll notice right now that the view in the panoramic window is cut off at the third molars. That's because if I click right here, you're going to see that the focal trough is only extended to the third molars. So one of the first things I always do, especially in a mandibular case where it's important to be able to see the nerve clearly, is I'm going to grab this small dot right here. You'll notice that it's a little hard to see because of the grayscale, but you're going to grab that, left click it, and pull it back. Extend that the full length of the mandible. Okay? Now you'll see the effect of doing that. Whenever I did that, now the view extends back completely to the distal of the mandible on that side. We can do the same thing with the other side. And so again, this is one of the first things I do in every single case. Now, the cross-sectional window right here, you're going to see the cross sections are only as wide as the focal trough. Okay, so in these three views right here, all you're seeing is the blue, yellow, and red line, and you're seeing it in a width from here to here in the yellow focal trough. If I need to expand that, let's say that we're not catching the maxillary and the mandibular teeth all in one view, you can grab the corners of the focal trough and you can pull it in or out by left clicking and dragging. So I usually go about right there and I make these the full width of those windows, and generally that's going to be just fine. If you need to expand the panoramic window, you actually do that by hovering in the panoramic window and you would scroll forward. Now this is something I generally recommend you not do because usually the software defaults to the right view, and if you go messing with this and accidentally scrolling, it'll get your panoramic curve off and then you have to go reset it. If you need to bodily move the panoramic curve, you can grab the red dot, left click it, and move it around. Again, I would generally recommend you not mess with that because usually the software will default to the ideal setting. As far as just the basic views on this though, we can still scroll up and down to go up and down through the volume. We can still bodily move it by right and left mouse clicking and dragging. And we can zoom in or out by pushing with our mouse and holding the right mouse button down. Okay, so very important window. We'll definitely be using that quite a bit as you proceed through learning Blue Sky Plan. Now the next window, this is your tangential window. And so again, you'll notice it's color coordinated. This is the green outline and it's going to correspond to this green outline right here. This is a tangential window, so it's always going to be at a tangent from the cross sections in the panoramic trough. And so you'll notice if I hover in this window and I use the scroll ball, you're going to see that rotate around in a tangent from the center of those cross-sectional views. Now that may not seem like that's very necessary. Obviously right here it's nothing more than a cross-sectional view. If I go this way, if I wanted to look at teeth like straight on from the buccal and see multiple roots at once, this is how I would do it. I would orient this line along the teeth. But the reason this is important is going to be when we start planning implants, if you click on an implant, it will center that view right on the implant, and now you can rotate and spin the implant on its axis. So I use this a lot when I'm planning my implants. I'll generally drop it into the case, and then I do my fine-tuning positioning with this tangential window. So very useful, and we'll come back to that for sure. Again, we can maximize this or minimize it, and that's the tangential window. And finally, this is the panoramic window. This is what is known as the composite view. Remember, you will want to stay away from your scroll ball in this window, because if you do, it's going to expand or contract your panoramic curve or panoramic trough, which is generally something we don't want to do. Right click and push forward is going to be zoom, and then if we want to bodily move, we can hold down the right and left mouse button simultaneously and push forward, or move it wherever we want to go. So if I wanted to zoom in on this third molar, I could bodily move it to the center of the screen and then just hold the right mouse button, push forward, we could zoom in there. So I usually don't do that. I'm typically going to leave this just like you would see right here. And I'm also going to show you, obviously there's maximize and minimize. And you're going to notice this view looks right now just like a traditional pan would, a film pan 2D. We can also go to what's known as the slice view. So this little yellow and black badge that you see in the middle here, if I click that, now I'm in what's known as a slice view. You'll see that the panoramic curve has disappeared, and now there's just a single line. So what you are seeing reflected here is just this single line. It's a single slice in the focal trough. Again, I could expand or contract that by scrolling, and this is going to be useful when we start mapping the nerve, because you see right now, as we are in this window, we can't really see much of the nerve, but there are ways that you can orient your panoramic curve such that you can see the nerve throughout its entire length, and that's going to make it very, very easy for us to map the nerve accurately. And so remember that. We'll come back to it in just a moment. And I believe that is all of the functionality. If you need to change the density of your 3D rendering, you can grab the slider at the bottom of the 3D rendering window, but usually the software is going to default to what's ideal, and so I don't think you'll have to play with that too much. Alright, so let's go ahead and start the actual case now that we've reviewed the mouse functionality. And so one of the first things that we're going to want to do in a mandibular case is plot the nerve, because we obviously don't want to hit that. And so you can come up here and click this plus nerve button. Now I'm going to show you a couple of different ways that you can do this. First of all, before you do that, I want you to center the view, and remember, anywhere you click in Blue Sky Plan, it's going to center all the views on that. And so you see that I've clicked right here in the area of the mental foramen. One of the ways that we can plot the nerve is with the auto functionality. Okay, so right now it's going to default to the manual functionality, but if I go up here rather than that and I select detect nerve, now it's going to tell me just to click inside the mental foramen, and it gives me an indicator of where it wants me to do that. So I'll go over to my cross section and I'm going to just do a single left click in the foramen. And this is an auto nerve detect function. Very nice, and when it works, man, it is really, really quick to do this. And as you can see, it's done an excellent job here. It only trails off right as it leaves the lingula, and you could scroll through and see that this is in fact accurate throughout the whole volume of the mandible. Now, in my experience, this is going to work really well when you've got a pretty distinct mandibular canal with good cortical borders on it. If you've got one of those mandibles that's very porous, that's hard to see the canal in it, this function is going to struggle to plot a nerve. And so you need to know how to be able to do that manually as well. So on the other side, I'm going to show you how to do a nerve manually. All right, so we've got one nerve in the case already. If you want to lock this so that you don't accidentally knock it off, you can click the padlock icon right here. Until you do that, you can still modify the position of these nerve nodes. So if I wanted to fine-tune this position, I could grab this and I could drag it around any of those nodes can be clicked on and drug into place. Once I click the padlock button, that is now locked and there's no worry of me knocking that off. Okay, let's now do the other side with the manual nerve mapping function. All right, so what I want to do here is, first of all, before I click add nerve or any of that, I want to go up here and go to the slice view. Remember a moment ago I told you that that would be very useful when we're plotting the nerve. And so first of all, what I'm going to do is I'm going to use the mouse button and I'm going to expand my panoramic curve till I begin seeing this right here, which is I want to see the canal for its entire length. Okay, you can see the mental foramen right here, but I can't see it really clearly for its entire length right now. So what I'm going to do is I'm going to play with these nodes. Any of these nodes that I grab, I'm going to move this to the center so you can see it clearly. Any of these nodes that I grab, you can see as I move that laterally, it's changing the view. And as I pull it back toward the lingual, I can see that nerve come into view very clearly. All right, so you're going to go one by one and you're going to position all of these nodes until you can see that nerve clearly throughout its entire length. All right, so this one here, here's where I'm missing clarity on this. So I'm going to move that one. Now I can see it. And sometimes they can be hard to see. And this is why oftentimes it's going to be difficult for the computer to do a nice job of rendering that. There we go. All right. So I could perhaps move this just a little bit right there. Okay, excuse me. I've realized I will not be able to get through one of these videos without a phone call interrupting, so we'll just have to deal with it. All right, if I remember where I was leaving off, we're trying to get the mandibular canal in view for its entire length, and so we're doing that. We want to make sure that we adjust these all until we can see it throughout its entire length. And so now if I zoom in here, you can see that this has a continuous cortical boundary all the way from the lingula up here down to the mental foramen. Now, once I have that, now I'm ready to add nerve. And so we've already got this menu up. If you didn't, you could just click on the plus nerve, but right now I'm going to click add nerve. When I do that, you'll see that this turns red. That means it's active and it's ready to begin dropping points. That's why I have the crosshairs on my mouse. So I'm going to click up here and we're going to map from the top of the mandible down, and just click your way inside of that canal all the way down the mandible. And because you are looking at only a single slice in this view, it's unlike the composite panoramic view where you might be dropping it in the right position horizontally. And there's another call. Now it's important that as you approach the mental foramen here, you need to slow down and you need to kind of space your clicks a little closer together. And what I'm looking for is eventually when I click here, you're going to see the mental foramen appear up here in the cross section. Once you see that, now don't click anymore right here. Come up here and click at the mouth of the mental foramen and then click once out in space, and now you're done. Now again, very important here. This is still active, and there's a big tendency to, now you're done mapping, but if you don't turn it off, you'll click somewhere else on the screen and it's going to drop a point, they'll have a nerve going up to their eye or whatever. So to deactivate this, you've got to come up here and click this red button where it says Edit Nerve. And so now that's going to deactivate it where it won't drop more points, but it's still not locked, so we can modify it as necessary. Now, how do we look for an anterior loop? You're going to do that in the axial view. So get up here at the area of the mental foramen, and you can maximize this axial view. And you're going to want to scroll down until you see where the nerve is exiting from the mandible. So I'm going down, it should be approaching here. There we go. Now I'm looking and this panoramic curve is obscuring my view somewhat. That's known as a projection, and we have a button up here that says all projections. If I click that, it will turn that off. And so sometimes your screen is just going to get really busy and you need to turn some things off. That's the button that would do that. Okay, so now I can scroll up and down through this, and I'm looking to see if there's any area in the proximity of this mental foramen where that nerve is swooping forward? If so, I would need to adjust these things and drag it up to match that. However, I'm really not seeing that. Now, what I do see is going down inferior and taking a dive, going downward into the anterior mandible is this smaller canal. Now, oftentimes people will confuse that with a anterior loop. That is actually the incisive branch, and if you tract that, you can continue to see it going on up here. That is the continuation of the mandibular canal. It supplies the artery and nerve to the mandibular incisors, but that is not something that we need to worry a tremendous amount about. So we're mainly looking for that true anterior loop, which I'm not seeing on this case. So everything is good. And once we know that everything is good, we want to lock that nerve, and we're done with this case as far as mapping the nerve. So you can see both nerves here are mapped accurately in, and they're in the proper position. Now we're ready to stitch in an STL model. So this data obviously is not clean enough to do a surgical guide on. We can see the bone and the anatomy, but we need a nice model that we can build a surgical guide on that's going to be much more clear. And we do that by stitching an STL. So come up to your File menu and go down to where it says Import STL. Now there are multiple ways of stitching an STL, and for purposes of this one, let's just assume this is a case where you sent a stone model to your lab, they digitized it and simply emailed you an STL model. And so that's what we've got right here. This is under that same folder, and this is called Case 1 Gingiva. All right? So we're going to OK this. And when we do that, this is going to come up. This is the stitching window for the STL models. Now, the software defaults to a method called matching teeth. That's what you're seeing right here. What you'll see is a view of the panoramic view, composite panoramic. It's important that you had your panoramic view set appropriately before trying to do this, because otherwise, if you have a screwy looking pan, it's going to look terrible here, and you're not going to be able to see these teeth clearly. And then in this window is your STL model. Now you don't see it currently unless you look closely. Right here it is. Just if you don't see something, right click and pull back. That zooms out, and you ought to see this come into view. I can right and left click and now zoom back in, and we can see this STL in its entirety. Okay, so what we're going to do is drop corresponding points from one tooth to another, matching teeth. This is not where we want to have to be real specific and drop them on, let's say, the exact same cusp tip. We just want it on the same teeth. The way we do that is to push the Shift key on your keyboard, and you can see my mouse turns into a crosshair, and then I'll left click once, let go of Shift, and then I'm going to come over here and I'm going to left click once and push Shift. It's going to drop a point on that. I generally will do every other tooth. So I'm going to just come through here and do every other tooth. And again, if you've not set your panoramic view appropriately, this is going to be difficult for you to accomplish. And again, here's where you have to have control of your mouse, because otherwise you're going to really struggle to get this model into view where you can see these. So we need to be able to move it bodily and position it appropriately. And now we have those. Now I've got 7 corresponding points. I'm going to click Align. The software is now going to attempt to do an auto stitch of this. And here you see the stitch that it came up with. Now it's very difficult just based on this to tell if that's an appropriate stitch. So if it looks relatively close, I'm going to just click OK, but now we've got to go back and verify the stitch. Now please hear me when I say the verification of your stitch is absolutely the most important step in this entire process. If you screw this up, the whole case is guaranteed to be a screw up. So do not proceed until you've verified that this is a really accurate stitch. Now there's 2 windows I do that in. There's the cross-sectional window and there's the axial window. So I'm gonna enlarge the axial window, and once again the screen's a little busy here, so I want to turn off the projections just for a moment. Now what I'm doing is I am scrolling up and down through the volume, and as I do that you're going to see this model outline. That model outline should be really tightly adapted to the teeth. Okay, this is pretty darn close. Now it's not perfect, and I'll come back to why that is in just a moment, But then in this window, you're going to enlarge it and you're going to scroll through, and you once again ought to see a very tight adaptation of this. Now, it's not perfect. It's very close, but if I zoom in here, you can see that this is off by maybe a millimeter here. And in my experience, the software can auto-stitch it correctly maybe 50% of the time. Other times, you're going to have to go back and manually stitch it. You should never, ever just automatically trust that the software did it correctly. So when I see that, that tells me that's a little bit off. When I see in the axial window that as I zoom in right here, you see how that is not following entirely correctly. And then particularly on the axial window, you can see these little discrepancies. But most of all, when you start getting to cusp tips, do you see how the cusp tip is disappearing on the model outline, but it's still fully present in the cone beam rendering? And so those are just not quite stitched accurately. You see this, still lots of cusp tip present, but it's pretty much disappeared in the model outline. So this is one that I would want to go back and stitch, and that's a good thing because I want to show you how to do that manually. So let's assume the software didn't automatically stitch this entirely accurately. We need to go back and do this by the manual way. Now, before we manually stitch, you're going to want this maxilla out of the way, because what we'll do in manual stitching is we're going to go and pick very specific corresponding points from one cusp tip to the other cusp tip, one buckle groove to the other buckle groove. And as you can imagine, if I'm trying to look at occlusal features on this 3D model, that maxilla obscures my view. So I want to get rid of that. The way we do that is to go to Panels and Surfaces panel. Now in the Surfaces panel, you're going to see, you'll have to scroll down to the bottom right here. There's a function called Isolate. So I'm going to click that. It's red. That means it's active. And now I'm going to click on the mandible. Whichever jaw you want to isolate, click on that jaw. And essentially what is going to happen is anything that is not touching the mandible is going to disappear. So I'm going to do a single left click on the mandible, and you'll see the maxilla disappear now. And then the tool will turn off automatically. Now, you can imagine that if the patient was biting down during the scan, that tool is not going to work, and it's going to obscure your entire view, and you're going to have great difficulty in stitching. So it's my recommendation that anytime you're planning for implants and you're doing a tooth-borne guide, you need to have the patient open during the scan. You don't want them biting into occlusion.